Okay, Trish, so you've had your appliance now for a month or so. And your headaches have gone from being,
Probably on a scale of 1 to 10, probably 9 to 10 at times, down to maybe 1 to 2.
and in your hometown, which is an hour and 10 minutes away, you're working with a great massage therapist.
Yes.
But here we have thumbs.
Yes.
Chris Thomas that is still looking for trigger points, even though
he's
you're
pushing on one right now.
Right there.
There's one right there.
So even though the appliance is taking away your pain,
He's got a spot right there.
working with a massage therapist or a chiropractor that understands what we're trying to do is a very important deal.
Yes. So, he's right on the money right there.
And I'm just at the base of the skull. She told me she did some yard work and things of that nature, so that's going to put her on a forward
Okay,
head.
now why are you twisting her head as...
Just to make me get more, I'll go here, just to give me a better angle in there. Then sometimes I can check rotation, just how far she can turn to the right.
Okay, so her range of motion is basically pretty good for a person.
Right. Oh, yeah. Because I've seen it a lot
posture.
worse. But I'm just going right at the base of the skull. Here.
Now this side is not quite as tender.
So on your headaches that you had before the appliance helped, which side were they on the most? I know you wrote it down.
It tended to be, I think, on my right side the most because it would go down into the muscle in my upper back, and I had knots in my back.
But today you feel it more on the left, or is just against?
He's got it when he pressed on this one over here. It was pretty sensitive, but I have noticed when she's worked on me before that it's gone over to this side now a little bit more.
Okay, predominantly.
Yeah.
In the appliance we adjusted today, we adjusted predominantly on the right. You were hitting harder on the right.
Yes.
And this is your second adjustment that we're doing today?
Yes.
Okay. And so you're doing, what are you feeling, Chris? And tell me.
Just a ropey muscle, like a guitar string here. She probably can feel me.
As I said, it's like
playing a little tune
steel bands.
But just a little tight muscle here.
Yeah.
So you could tell that muscle's been overworked or in a position where it's being overworked.
Now, you have some home exercises for this?
Number one would be for her to, if this was her headrest in her car, I'll tell her to push back into that headrest, like for a count of 10 while you're driving. Do you feel that tense up back there when you do that? So do that, keep doing it, and relax, and then again, and you can feel these muscles, they tighten, and do it again. So what it is all day long we're looking forward, so these muscles are contracted because, you can see it's holding our head forward.
Yes.
So we just forget about these muscles.
Okay.
So we need to strengthen balance. If we work on the chest, we need to work on the back. If we work on the SCMs and scalenes, we need to work on the back also.
Okay.
So it's just making her more balanced.
That would be good because I get a lot of tension when I'm driving.
Yes. So push back. And these are always going to be tight on her because that's 35 years as a hairdresser right in there. These little thingies there. And the reason why these go with that, because if these can come back, the head can come back with it.
Yeah.
As our shoulders round this way, our head tends to come forward.
Now, when those shoulders come back and the head comes back, then the jaw is going to go forward.
Yes. Yep. Yes, sir.
And so then she will still need to be adjusted every once in a while. The more she exercises and the more she corrects her posture, the more she must understand.
I need to have my shoulders back more.
Yes, you want good posture.
No, I try not to. I try not to do that. Yeah.
And if you catch Dr. Max, sometimes he'll sit on this pillar while he's talking.
Yeah.
Train him to kind of put his shoulders on the wall in a sense, as opposed to just kind of being in that position.
Right. Well, I know when I had some lower back problems, I had a saddle seat that I sat in while I cut hair, and it really makes you sit up straight when you sit on one of those.
Well, dentists are like you. We have to bend over the mouth all day long, so we really have posture problems. So this is an important message for dentists, not only just treating people, but also watching for your own posture.
Longevity of your career, pretty much.
That's right, and for me, that means something.
Right.
Okay, thank you, Trish.
No problem.